Rural America's hospitals are in crisis, with many on the brink of closure. When a hospital shuts down, families are forced to travel long distances for care, sometimes with life or death consequences. President Trump's new plan aims to change that, delivering $50 billion to keep rural hospitals open. This is more than just funding, it's a commitment to the farmers, workers, and families who keep our country running. The plan ensures that your zip code won't determine your access to quality healthcare. For years, rural communities have watched their hospitals cut services or close entirely, leaving families anxious and underserved. Now help is on the way. This investment will rebuild and modernize rural healthcare so every small town can have a strong, reliable hospital. Imagine a future where you get the care you need, close to home, without a long, stressful journey. The $50 billion plan is a bold step to make sure rural Americans aren't left behind. By supporting local hospitals, we're investing in the health and strength of entire communities. This plan is a lifeline, helping essential hospitals not just survive, but thrive for generations. It's about hope, fairness, and a promise to never forget rural America. With this plan, we're building a healthier, more secure future for millions. Rural hospitals are the backbone of their communities, and this plan gives them the support they need. The message is clear: no American should be left without care because of where they live. On January 16, 2026, President Trump announced a $50 billion plan to rescue rural health care. Speaking at the White House, he promised to save struggling hospitals and ensure rural Americans get the care they deserve. The announcement came during a special roundtable focused on rural needs, part of his broader, great healthcare plan. President Trump spoke passionately about ending years of neglect for small towns and farming communities. The plan will revitalize rural hospitals with better equipment, more doctors, and expanded services, so people don't have to travel far for care. This is about fairness. Every American, no matter where they live, should have access to quality healthcare. The timing is crucial, showing healthcare as a top priority as the 2026 midterms approach. By putting forward a clear, ambitious plan, President Trump is demonstrating his commitment to rural America. This is a positive, solutions-focused message for millions of families. The $50 billion investment is a direct promise to put rural communities first. It's a bold move to improve lives in every corner of the country. Where will the $50 billion come from? Not new taxes. Instead, the funding comes from cutting waste, fraud, and abuse in Medicaid, a program meant to help low-income Americans. Billions are lost each year to mistakes and fraud in Medicaid. The Trump administration is using better technology and stricter rules to stop this waste. The savings will be redirected to rural hospitals that need it most. This is a smart, responsible way to use taxpayer money, helping communities instead of letting funds disappear. By cracking down on fraud, the government can fund rural healthcare without raising taxes. It's a common-sense solution. Take money that was being wasted and invest it where it matters. This approach protects Medicaid's integrity and provides a lifeline to rural hospitals. The plan ensures resources go where they're needed most. It's about making government work better for the people. Rural hospitals get the support they need and taxpayers get better value. The $50 billion Rural Health Plan is part of the One Big Beautiful Bill Act, a sweeping effort to fix American healthcare. This act tackles multiple problems at once: rural hospital closures, high drug prices, and expensive insurance. Price transparency is a key feature, so you'll know costs before you get care. The act is a roadmap for a simpler, more affordable, and more honest healthcare system. By bundling popular reforms, the bill aims to win broad support in Congress. The rural funding is just one piece. The act also lowers drug prices and insurance premiums. Everything is packaged together for clarity and impact. For the $50 billion to reach hospitals, Congress must pass this bill. The act is designed to make real, positive changes for patients everywhere. It's a bold, ambitious plan to overhaul healthcare for all Americans. The One Big Beautiful Bill Act is the engine driving this transformation. Rural communities are counting on it to keep their hospitals open and strong. The $50 billion will be distributed in two smart ways. First, $25 billion is divided equally among all 50 states, giving every state a solid foundation to strengthen rural healthcare. This ensures no state is left out, and every rural area gets a boost. The second $25 billion is targeted based on need. States with more struggling rural hospitals will get a larger share. This approach directs the most help to the places facing the biggest challenges. The two-part system is fair and flexible, providing both a national safety net and targeted support. States can start making improvements right away, with predictable funding. The plan adapts to real-world needs, preventing closures where the risk is highest. It's about maximizing impact and saving essential services for the communities that depend on them. Every dollar is aimed at keeping rural hospitals open and effective. The plan isn't just about money, it's about new rules to make healthcare better. One major change: price transparency. Hospitals must post prices for services if they want Medicare or Medicaid funds. No more secret costs or surprise bills. Patients will know prices up front, just like any other purchase. This empowers patients to compare costs and make informed choices, driving competition and lowering prices. The plan also targets high drug prices and expensive insurance premiums. Lowering these costs means more families can afford the care they need. These reforms work together: transparent prices, lower drug costs, and affordable insurance. Rural hospitals benefit, but so do families everywhere. The goal is a healthcare system that's more honest, affordable, and patient-centered. With these new rules, everyone wins, especially those in small towns. The plan brings clarity, fairness, and relief to American healthcare. It's about putting patients first, no matter where they live. This is real change for real people. This plan was crafted by a dedicated team in President Trump's administration. Health and Human Services Secretary Robert F. Kennedy Jr. played a key role, emphasizing care for all Americans. Dr. Mehmet Oz, as head of Medicare and Medicaid services, is leading efforts to cut waste and deliver new funding. Agriculture Secretary Brooke Rollins highlighted the link between healthy farms and healthy communities. Governors and members of Congress from rural states, like Nebraska's Jim Pillen and Arkansas's Dan Sullivan, voiced strong support. Their unified message, rural healthcare, is a national priority. This is a whole-of-government effort, with leaders bringing expertise and passion to the table. The team understands rural challenges because they hear from their communities every day. Their support shows this plan is more than politics, it's a practical solution. Together, they're working to make rural healthcare stronger for everyone. For small towns, the local hospital is more than a place for care. It's an economic anchor and a lifeline. When hospitals close, jobs vanish, and families are forced to move, hurting the entire community. This plan keeps those jobs local and supports families. In emergencies, every minute counts. Keeping hospitals open means help is always close by. Strong hospitals attract more doctors and specialists, so people get care without long trips. The plan helps rural hospitals modernize and expand, becoming true centers of health and wellness. It's about fairness. Rural Americans deserve the same care as anyone else. For too long, small towns have watched their services disappear. This plan is a promise. Your health matters, no matter where you live. It's an investment in the future of rural America, keeping towns vibrant and families safe. With this support, small towns can thrive for generations. This plan offers hope for a stronger, healthier rural America. Leaders like Secretary Kennedy and Governor Pillen call it a lifeline for communities. Redirecting wasted funds to rural hospitals means better care, more doctors, and new services. Oversight will be crucial, but the potential benefits are enormous. Hundreds of hospitals could be saved, and families could see real savings on care and prescriptions. Price transparency and lower drug costs will ease financial stress for millions. President Trump's $50 billion plan is a bold, practical solution to a real problem. By investing in rural hospitals, we're investing in the health and future of our nation's heartland. The One Big Beautiful Bill Act is the vehicle for this transformation. It's a promise to rebuild, revitalize, and respect rural America. With this plan, small towns can look forward to a healthier, more secure future. Rural Americans will no longer be left behind. This is a new chapter for healthcare in every corner of the country.